Welcome to the Big C podcast series, an initiative of the Algo FM Big Walk for Cancer. I'm Caroline Kelleher. This is episode 5, and we are focusing on the most common cancer worldwide among women, breast cancer. Surviving it, how the right specialists can make all the difference to a cancer journey, and how there is always hope. And with me for this all-important discussion, we are privileged to have another highly regarded specialist in studio with us. Welcome, Dr. Ronel Gowar.
Thank you guys for having me.
Thank you. And someone who wears so many different hats, and we'll get to all of them during the course of this chat, not once, but 2-time breast cancer survivor and former patient of Dr. Gowar, Gill Forlee. Morning,
Hi,
Gill.
CA. Hi. Thanks for having me.
Thank you so much for coming to share your journey with us. Gill is also my fellow work colleague at Algo FM, and she is the executive PA to our MD, Mr. Alfie J. Ronel, Gill has been so blessed to have had yourself and Dr. Kathy Walton on her medical team. She speaks so highly of both of you, and this is what I want to talk about, because it is not only your skill as a surgeon that is so amazing, it is your compassionate approach. So can we start with you sharing your mom's cancer journey with us? Because that's how your relationship with oncology, is it called oncosurgery? How do you?
Yes. Oncological surgery or oncosurgery.
Began.
So my mom was diagnosed with breast cancer in 2007, and she had actually had an abnormal mammogram, a lump on her mammogram for years before that. And every time somebody had a look, they said, oh, no, don't worry about it. And I was sort of reasonably fresh out of university and was quite aware of the fact that you don't just ignore a lump on a mammogram. And she saw a surgeon who was a little dismissive and said, well, if you're the hysterical type, we can cut it out. Otherwise, see me in a year. And so my mom's not the hysterical type, I am. So I insisted she must get a second opinion. And that surgeon just said to her, look, he knows me, so he knows I'm going to nag, so he's just going to biopsy it anyway. And then it came back as a cancer, and everybody was quite casual about it and almost a bit blunt. I mean, he actually phoned me the day before her follow-up appointment and said, your mom's got cancer, do you want to tell her or should I? Sure. And I thought, wow, if that's how she's going to get told, then maybe I should do it.
What year was this, Ronel?
That was in 2007.
So it's not that long ago.
Oh, well, I suppose medically that's probably a long time ago. Thankfully, a lot of things have changed.
Good. It's good to hear.
I suppose that was the first time in my life I had to sit and think about how to tell somebody they've got cancer. Mm-hmm. Our medical training I think it's guided towards keeping us clinical and keeping us professional, but it also risks us blunting ourselves off to the emotion behind a cancer diagnosis. So, I mean, I've often reflected and I've often said to my mom, I think she got breast cancer just to put me on the path that I'm on, because, I mean, I gave her the news and she accepted it, but we saw the surgeon and he said, well, look, go see the oncologist. You can have a mastectomy or you can have radiation. It's your choice. And that was it. That was literally it. And then we saw an oncologist. Her oncologist at the time was Keith Mart. And the man had the patience of Job. He spoke so nicely, explained everything so nicely. And I asked so many questions, and I asked the same question over and over, and some of them were quite stupid, really. And he just stayed patient and kind. And I'll never forget that. As we walked out of his office, and I stopped dead in my tracks, and I said, Mom, when I grow up, I want to be Keith Mart.
That's wonderful.
No, I never wanted to be anything other than a surgeon of sorts. And so I never wanted to be an oncologist. But certainly that interaction made me think, you know what? Why are we as surgeons, why can't we just be a little bit more kind, a little bit more sensitive? And my mom went through a second cancer, well, not scare. She had cancer. She had uterine cancer in 2018. So it definitely makes a difference if you've been on the other side of the table. Yeah. So on 2 occasions, we've received bad news.
Yes. Yeah.
And so I think when you know what it feels like to receive bad news, I mean, I often, when I diagnose a patient newly, I give them a list of websites that they must use when they go and Google. And then my patients often look quite surprised that I'm telling them what to Google. And then
because they're going to Google.
And then I always say, but I also Google things. When my mom got uterine cancer and I don't know anything about it, I Googled it because I wanted to know. So I think that makes it a lot easier to deal with patients when you know what kind of fears go through your mind, what questions you have. And then, of course, the practical implications. You can just explain everything about a surgery to somebody, but if you don't explain that when you get home, you'll need somebody to, help you shower, you should prepare meals. I mean, little things that just make the discharge period even easier. So that's where it all started.
Wonderful. Wonderful. And Gill attests to, she speaks so highly of you, Ronel. It's, So Gill, can you share your journey with us from that diagnosis and the shock and...
The first time, both times.
Oh, yes, we want the whole story.
So the first time I was diagnosed in 2018, I found the lump myself. And then I went to my gynae, who referred me to a surgeon who was exactly like the surgeon that Ronel's mom had, because he did a biopsy and I walked into his rooms, and before I'd even sat down, he said, "Oh, you've got cancer."
Sure.
And I was still trying to digest that, and then he was saying, and then I said to him, "Well, am I going to die?" Because in my mind, if you had cancer, you were going to die. And then he said, "No, you're not going to die, but you can have a bilateral mastectomy, you can have a single mastectomy." And I said, why? Why do we go from I'm not going to die to needing radical surgery? And then he kind of brushed me off, went in, and I had the lump removed, and which was followed by 15 rounds of radiation. Then I was referred to Kathy Walton, and she was the best because she actually put me at ease. She explained everything nicely, so that I could actually sleep at night, because I was petrified. He hadn't explained anything. I went to him, had the stitches removed, and he was like, "Great, fine, see you. Thanks for coming, thanks for going." So then I saw Dr. Walton, and she explained everything so nicely, and she actually treated me like a human being.
Yes.
And then I've been with her ever since. Then in 2022, I went for my normal checkups, my annual checkups, and they picked up another lump on the opposite side.
How did that feel, Gill? I mean, you talk about it so matter-of-factly now, but I mean, emotionally, what you've been through, it's huge.
Yeah, it was, I'd gone expecting to have just another clear round of tests like I'd always had. And then Dr. Walton said, "Well, I've got some bad news, because we've actually picked up a lump." And I sat in and I looked at her and I said, "You have got to be kidding. It just can't be happening again." Then she said to me, "Look, we've got to biopsy it. So I'm going to refer you to a surgeon, so that you can have a biopsy, and then we'll take it from there." So then she did say to me, "Look, this one seems to be a bit bigger than the last one. So we actually can't waste any time. We need to move quickly." And that's when she referred me to Ronel.
Okay. And then this is when you become part of the journey.
Yes. So, when we look at breast cancer, we're always preaching about getting early diagnosis, etc., etc. And then suddenly in a journey, there's a point where you say to everybody, "Okay, slow down. Don't make hasty decisions." So it almost seems a little bit, crazy, but definitely with Gill, first consultation, we needed a diagnosis. It didn't look good on imaging.
Yeah.
And one of the ways, and it's a nice, easy way to get a diagnosis, is to do a core biopsy, which we did that first time. And I'm sure as hard as it was for you to hear, "Sorry, you've got cancer again for the second time," it's also not fun for me to tell you you've got cancer for the second time.
You still called me. You still called us after hours.
Yeah, and said, "Look, we're going to have to tackle this one."
Yeah.
Yeah.
And
so
then
that started
from there,
you off on, you went back to Kathy, had your staging.
Yeah, then we had staging done, and
what is for those who are not familiar with the term, staging?
Do you want to give the technical?
Well, it's a set of investigations that gets done to see whether or not the cancer has spread into a dangerous organ. The surgeon in Joburg always says a breast cancer in your breast can't kill you. It's the breast cancer that spreads out of your breasts that can kill you.
Yeah.
So it's usually a CT scan, but we can quite easily do the same thing with a chest X-ray and an abdominal ultrasound. And it's just, we're looking at the organs that breast cancer typically targets. And on that basis, we then decide whether or not it has spread somewhere. But we advised neoadjuvant chemo for you.
Yeah.
Which is chemotherapy before surgery.
Yeah.
Oh, okay. So is that to what does the chemo before the surgery do?
So it does a couple of things. Number one, if there's already cancer in an organ, so there's already metastasis, then it's designed to sort of tackle that.
Okay.
It can decrease the size of the tumor, which can influence the type of surgery you're going to have. But the main reason for it is to catch all the what we call circulating tumor cells. So where a tumor sits, cells essentially break off and can potentially spread through your lymphatics and your blood system, and at some point find a new home.
Okay.
So when I diagnose a patient with cancer, specifically breast cancer, I like to explain it, and this is, just for the record, a very simplified way of looking at it, but it does explain why we do what when. So where a lump sits, that tumor in a breast, that's the factory. And the factory can't kill you. It's the product of the factory that can kill you. So the rest of the breast tissue around the tumor and the lymph nodes in your axilla usually, that's the distribution line. So the tumor sits there, produces cancer cells. Those cancer cells then spread through the rest of the breast tissue, through the lymphatics. And then that product goes out into the system.
Okay.
So a product can already be on a shelf. So if there's a tumor already visible in the liver or in bone or in the lungs, that product is now on the shelf.
Okay.
But we never know what product could be hiding somewhere in a storeroom and decide a year or 2, 3, 10 years later to suddenly be put on the shelf. So chemo, that is designed to remove the product.
Right.
So when we diagnose somebody with breast cancer, even if they don't already have a product on the shelf, the nature of that product, the nature of that histology that we get from the biopsy, that tells us what's the likelihood of product being somewhere in the system, like hiding out in a storeroom or a back room somewhere.
Yeah.
And that's when we give chemotherapy. So usually if somebody needs chemo, we'll actually do the chemo before the surgery because it's the product that's dangerous, not the factory. And then our next step would be to go and close down our factory and to try and obliterate our distribution line.
Yeah. Because this tumor, by the time I started chemo, the cells had already started duplicating faster.
Okay.
Yeah.
And is this when you have the red angel?
Red devil. Red devil / red angel. Yeah.
And is this... And talk us through that experience because that is quite brutal, isn't it?
So then Dr. Walton explained that because this cancer was more aggressive, I would need to have red devil. And then she also said it's not actually red devil, it's red angel because it's saving your life. And I would have to have 6 months of chemo.
Sure.
So that's quite it's very scary because you've seen the movies and you've seen how people are sick and all that sort of thing. And the thought of having to go through that was actually very scary. Not so much for myself, but for my family. I didn't want them to see me being ill.
How did you, the family dynamic, Jill? Because, Ronel, it has a huge impact. It's not just the person who's being diagnosed and who's going through treatment. It's a whole family who's part of this journey.
Oh, absolutely. I've never personally had cancer, so I'm saying this with respect, but I often suspect it, and I mean, maybe I'm generalizing, but, if you're the person who's been given a cancer diagnosis, I think something happens where you go into survival mode and obviously you have your down days, you have the difficult days, but I think deep down, everybody just wants to knuckle down and live and you'll fight and you'll, but the family member whose life isn't acutely threatened, that one thinks about everything else.
Yeah.
Yes.
I think it's actually harder for your family because they've got to see you going through it.
Yes.
And they can't do anything other than what they can.
Helpless.
And family members are often too scared to talk about their own fear. They sort of, I want to kind of equate it to survivor's guilt.
Yeah.
So you don't want to say to the person with cancer, "Oh, I'm scared."
Yes.
Because you're imagining that the person with cancer is probably more scared than you are.
Yeah.
So I think, for different reasons, you're carrying this burden alone.
Yeah.
I mean, I tell my patients, and when I see a patient and they tell me, I'm going for my first surveillance scan. So the staging scans is what the scans we do when you've been diagnosed and when we want to work out your treatment plan.
Which stage? Yeah.
Yes, and then surveillance scans are the ones where we've rendered you disease free, and we now want to keep an eye on things.
Right.
And at some point, it usually becomes an annual thing.
Yeah.
And often when my patients tell me it's my first set of surveillance scans, I tell them, listen, buckle down. It's a rough ride. It stays a rough ride. Every time you go for a surveillance scan, you're going to worry. And
it's called anxiety.
Yeah,
it's a real thing.
And incidentally, my mom had her surveillance scans about 6 weeks ago. And this year, 2025, is the first time since 2007 that I didn't lose sleep the night before her scans.
Oh, wow.
I mean, I'm sort of making light of it, but for me, I used to stress so much before every single scan that she had that in my mind, I'd start thinking about her funeral.
Yeah.
I mean, there's no reason to even think that, but I would try and brace myself for getting bad news again.
Yes.
So
it's hard.
It's a tricky journey.
How old is Mum now?
She'll be 79 in December.
Wonderful.
Oh, wow.
2-time cancer survivor.
Yeah.
Huh? Wonderful.
Oh,
you see,
Trojan. She is. She's a fighter.
Okay, Jill, let's get back to you and the Red Devil.
Yeah.
So I asked you what that experience was like. It must have been brutal.
So then I started chemo. It was the Tuesday after Easter weekend in 2022. And I remember sitting in my office on the Thursday before, and I was listening to everybody laughing and joking in the office, and they were all saying, oh, they're going to do this at Easter and making plans. And I sat in my office and I thought, you know what? They all get to do these wonderful things over Easter weekend. I'm preparing to start chemo on Tuesday. So that was my only actual pity party. Pity party for one, because it was a scary, scary thing. And then come Tuesday morning, I put my Algo FM t-shirt on that my colleagues gave me. And I thought, you know what? I've got to pull myself together. I've got to do this because nobody else is going to do it but me. And we went to cancer care, and Dwayne, my husband, could stay with me for the first half hour while they explained the side effects and what was going to happen. And I was fine while he was there. But as soon as he got up to leave, that's the first time I actually cried because this made it so real with this red drip that they connected, put the drip in, and then I realized this is happening. And because of the color and everything, I thought, wow, I'm going to sprout horns and I'm going to have a tail or something because it's so, so scary. Nobody can describe the fear that you feel because this stuff is actually going into you. And you know that it's such a strong chemical that you're getting. And I sat there and there was a girl, I always remember she was sitting next to me and she had her laptop out and she had her juice and she had all her things set up. And I thought, wow, look at her. She's so confident. She doesn't seem to have a care in the world. And she said to the sister, when the sister came to change her drip, she said, don't worry, I'm not going to cry today. And I thought, okay. Right. So this is real. We all cry here at some stage.
Side effects?
So they tell you nausea kicks in 24 to 48 hours after. Not me. My nausea kicked in that day as soon as I got home. I was so sick. But then I'd also refused to use the anti-nausea medication.
Why?
Because it was it was a, what do you call those things that you stick up?
Oh, suppository.
Suppository.
Oh, okay.
Oh, no,
I get
Jill.
that.
And I said to Sister Lydia at Cancer Care, don't even bother giving me that because I'm not going to use it. I've never had to use it and I'm never going to use it. And she said, just take it because you're going to need it. And then after like the third bout of running to the bathroom, I said, give it to me. And I used it. And you know what? It worked.
Yeah.
So the next time I went to chemo, I said to Sister Lydia, I'm sorry. I'm eating humble pie because it actually does work. And yeah, but I survived it. It was only the first that day. Then after that, it was fine.
What was amazing for me working with you is if I look back on your cancer journey, Jill was hardly ever off work. I mean, I think I can count on my hand.
I used to have chemo on a Wednesday. Take Thursday off, and Friday I'd be
You'd
back
be
at
back
the office.
there and always a smile on your face. Where did your strength come? Because Jill, we look at you and Ronel, as you were saying, when you haven't personally been through it, and sorry if I'm getting emotional, but we look at you and your strength and how you'd show up at work with a smile on your face. And for us, we kind of, what do I say? I want to say something. How can I make Jill feel better? How can I let her know I'm thinking of her? You know?
The thing is, it was coming to work was a lifesaver for me because it was one thing I could control. It was something that was still normal. It was something that was part of my normal routine. And all I wanted was to be normal. I didn't want people to look at me differently. I didn't want to be treated differently.
That's what Cherise, funny enough, also said.
Yeah. I just wanted to be me. But the really here at Algo FM was so amazing. I mean, the support that I got from Alfie right down to everybody. It was the most amazing thing. And it empowered me to feel like I can do this. I can get through this. Yeah.
As a woman, okay, we know that your breast is part of being a woman and one's hair is also. How did you cope with the hair loss, with the fact that we now have to do a mastectomy? So
losing my hair was quite a traumatic thing because, you think it's just hair, but it's not just hair because as it starts falling out, you actually realize, well, it's not going to be long and then I'm not going to have any hair left. So I made the decision that as soon as it started getting patchy, I would shave it. So I kept on telling everybody every Monday I would say, guys, just prepare yourself because this is the week I'm going to shave my head. And then everybody was like, okay, when you're going to do it type of thing. And then I thought, okay, it really got to the point where I needed to do it. So my whole family, we all got together and we all shaved our heads. And that was,
yes, I remember that.
That was that's the second time I cried, was when Dwayne had to shave my head. Because sitting there and seeing your hair, what's left of your hair, falling down on the ground, that is the most traumatic thing. Then, you kind of develop this very dark sense of humor when you have cancer. You joke about everything because it's either laugh or cry, right? So then I always said, I just hope I don't have a funny shaped head. As long as my head looks normal, as long as I don't look weird. And then he shaved my head and I thought, okay, well, it's not so bad, And then eventually I stopped wearing hats. I just came to work bald.
Yeah.
Because I used to walk around in the shops bald. And amazingly, people would come up to me and say, I hope you don't mind my asking, but do you have cancer? And then they would tell me their story. We'd be standing in the queue at Spa or at Food Lovers and people would tell me like, I went through the same thing. And it was so nice to be able to encourage other people. And then when I stopped the Red Devil, my hair started growing back. And then people would say, oh, look how nice you look. Your hair's growing back, So that also is a point of conversation to encourage other people.
And your support structure, obviously it's your family, but they are also going through an emotional upheaval as well. Your son and your daughter, how old?
Well, Tyler will be 27 in
And
December, and
Jordan
Jordan will be 22 next week.
There we go. And
Yeah.
those are youngsters, kind of, the prime of their lives. They're dealing with their own, and then
Yeah.
they have their mum, who it's emotionally for them as well.
Yeah.
Jill, did you ever go to therapy?
No, I didn't.
No.
I know Ronel recommended, and Dr. Walton as well said, if you need to go and speak to somebody. But I actually haven't felt like I needed to speak to anybody. Maybe in the future, maybe I do need to at some stage.
I think it's very individualized. I'm listening to your story and your experience of chemo, and you, right from the word go, you had a champion attitude, and you coped. But I was just, as you were speaking, I was thinking of potential listeners going, but I'm weak because I didn't feel that strong. I couldn't go back to work or things. So just to set the record straight, Jill, you are a warrior.
Yeah.
You are in a class of your own.
Yes.
And you
I'm
are a
stubborn,
beacon of
that's
hope
what
for
I am.
everybody. But you're also not the average. There are
Really,
a lot of women,
Ronel,
there are a lot of women for who it is a bit harder.
Yeah.
Where you don't just get 1 or 2 days off work, where you need to take more off.
Yeah.
And chemo needs to be postponed because it affects your blood counts and things like
Yeah.
that. So, of course, I'm obviously really happy for you that it went well for you. But
Yes.
there's many women out there where the journey is very difficult.
Yeah.
Charisse
yeah.
Hart was saying that she was so violently ill that and her headaches, she couldn't lift her head from the pillow.
Yeah.
So, there's a saying, an old African saying, about how do you eat an elephant? It's one bite at a time.
Yep.
And over the course of, my practice sort of developing over the years, I've accumulated a host of elephants in my practice.
All shapes and
so that
sizes.
everybody thinks that, my spirit animal is an elephant. It isn't. It's a hippo. But, for the chomp. But I've got loads of elephants in my office because I tell every patient the story. And, I got my own elephant when I went through my own, health scare a few years ago. But I try and, I give patients this visual of an elephant, because those days where it isn't easy, the only way you're going to eat your elephant is one bite at a time, one day at a time. And when you've got a good day, you take the good day, you celebrate it.
Yeah.
And when you've got a bad day, you take it, because there are going to be bad days. You don't deny yourself the opportunity to experience your bad day. It is, a pity party. It's a party still.
Yeah.
Because you're entitled to feel sorry for yourself. You're entitled to feel scared. You're entitled to feel sick and to feel pain and to feel all those horrible things, because it is happening to you.
Yeah.
But you just take that one bite and then get up, put one foot in front of the other, and keep going.
Yeah.
And I often tell my patients that, Jill is again an exception, but often when I diagnose a patient and I explain the path that's ahead for them, they you could see they sort of, don't think that it's ever going to change, or that, they don't see the light at the end of the tunnel.
Yeah.
And I always tell them, you won't believe this, but in 5 years from now, I'm going to walk past you in a mall. I'm going to recognize you, but you're not going to recognize me. And then they look at me and they're like, of course I'm going to recognize you, my cancer surgeon. And I say, I promise you, I will walk past you at some point and I'll look at you and you'll look at me and you'll think, I know that person from somewhere.
No.
But I promise you will forget me. And it maybe I've got a forgettable face. I consider that as an option, but it happens to me. It happens every few months where I walk past somebody, I remember that person, I remember their journey, and there's only a vague recognition from their side and off they go.
Yeah.
So, and I tell that story when I first diagnose people, because you need to know
Your life is going to...
However this journey goes for you, it's going to come to an end.
Yes.
And then life is going to carry on.
Wonderful.
As much as it doesn't feel like it now, life is going to carry on.
Because part of what you do is also being a psychologist, isn't it? But because of your approach as a doctor, and I think that is why Jill holds you in such high regard, is because of that holistic attitude towards the patient. And the counseling psychologist we spoke to, Tony Miller, also said that it's very important that a cancer patient, somebody going through this, does acknowledge their feelings as you said, because we do live in a world where it's like, get on with it, okay? Somebody
Yes.
passed away. Oh, have your day of mourning it out, back at your desk, let's
Yes.
go on, life
Yeah.
is da-da-da, that's really important that patients know that. But would you say, Ronel and Gill, that it's really important for patients to have a positive attitude? That Karen Brandt said when we chatted to her that you have to have, and she's a 3-time cancer survivor, you have to have a positive attitude. But for some people, maybe that's difficult to
find the
find
positivity.
the strength, and particularly if maybe your family situation is not great, you don't have a great support group, you don't, it's easy to say have a positive attitude.
I think, first of all, I don't think people know how strong they are until they need to be strong.
Yeah.
Okay.
Okay.
Yeah.
And I think when a person is diagnosed with cancer, it's really, really important for the treating doctors, whether it's the surgeon or the oncologist, to actually open that door about, and have a conversation about attitude. I suppose, with experience, and I'm just speaking from my own perspective, I can often tell that a patient needs a little bit more encouragement, or this patient's already got it. So I can definitely see which patient needs just a little bit of support so that they can find their good attitude. Over the years, just in terms of like the time span of my specialist training and how long I've been in practice, I can 100% guarantee that attitude is everything. You can have the best surgery, the best chemo, the best everything, but if you yourself haven't realized that this is something that you have to fight for, that as much as you have your bad days, the only one who gets you out of your bad day is you.
Yeah. Definitely.
You have to, and we see it. We see it in all kinds of aspects of medicine. A patient with a positive attitude will probably do way better than somebody who doesn't have a positive attitude. But again, I'm being sensitive to people who aren't born with the natural gift to just immediately see the silver lining.
I'm going to fight this, and I'm going to,
It's just reach out to those people around you. And, we often think that everybody's so busy in their lives and, I don't want to tell my colleagues that I'm not feeling well. I don't want to tell my friends or my family or whoever, my neighbor.
Yeah.
But for all of us, as soon as we start talking about a difficulty, for the most part, the people around us respond positively.
Yes.
And then we're always so surprised, when your neighbor suddenly, brings over food.
Yes.
Then you think, well, I didn't even realize. But why? I mean, because ultimately we as humans, we want to be part of a group. We want to be part of a community and a society. And we all really actually just want to help each other. So if you weren't born with a gene to just find silver lining, then go and knock on the door of somebody who has it.
Yeah.
Because it can be shared with you.
I always remember when I was going through chemo, there was a lady that sat next to me the one day, and she told me, we started chatting, and she told me that she and her best friend had both been diagnosed with the same type of breast cancer together. So they were on the same journey at the same time. And she said, the day that she heard she had cancer, she said, I'm going to fight this. I'm going to beat this. It's not going to get me down. And her friend said, oh, I can't do it. I'm scared of chemo. I'm not going to do it. I'm not going to make it, and all of that. And she said the two of them were given the same diagnosis. It was 6 years later, she was still alive and well and fighting. And her friend unfortunately passed away within 3 months of being diagnosed. And she said she firmly believes it's because she had the fighting attitude. And that's what you've got to have, because you can't let it beat you. Because if you're not going to fight, who's going to fight for you?
Yeah.
Gill, can we talk about early menopause? Because, I mean, you were really young when you had this battle, and the drug tamoxifen? Tamoxifen, sorry. You went into early menopause.
Yes, that I did. But the worst for me was that when I was a child, I had eczema. And then I outgrew it and I was fine. And as soon as I started tamoxifen, it caused a reaction, and I've been battling with eczema ever since. Then when I was diagnosed the second time, I went off tamoxifen because then I was, chemo pushed me into menopause or post-menopause.
Yeah.
Then I'm now on a medication called letrozole, which blocks the estrogen in your body because my cancer was hormone-driven.
So is that BRCA gene?
Yeah, and I tested positive for the BRCA gene.
Yeah.
Like Angelina Jolie.
Yes.
So letrozole brings with it a whole lot of side effects as well. You have the body aches and my skin, I've got to look after my skin very well. It's also I've got a trigger finger in my left hand. I have arthritis sometimes in my hands.
Okay.
But it comes and goes, and some people have a lot worse. So I always think, well, it could have been worse.
Mm-hmm.
Some people have constant bladder infections. They have all sorts of issues. So, yeah.
And Jordan, your daughter, in terms of the BRCA gene and the whole, because Ronel, I mean, we know, we need to know our family history genetically. So how has that impacted her?
So both my kids have, because I tested positive, she's had to start examining her breasts now already, and she's only turning 22 next week. Whereas normally I think you start doing mammograms at 40.
Mammograms at 40 if you've got average risk.
Yeah.
Mammograms at 40, but clinical breast exams from the age of 25 every year to every 3 years.
Yeah.
And then, imaging only from 40 for the average, for a person with average risk,
Yeah. So there's that. She's got to be, she's very much aware.
Mm-hmm.
So she self-examines.
Which is great.
And all those sort of things,
Jill, in terms of support, I was talking to Charisse about the fact that, we are in fortunate positions where medical aids and, you have the option. Do you want breast reconstruction? Don't you want breast reconstruction? Talk to me about Reach for Recovery.
Okay.
Because this has put you, your cancer journey has put you on another path.
Yeah. So while I was on my cancer journey, I was looking for a support group. I think I spoke to you a few times about trying to find a support group, and unfortunately there aren't support groups in Port Elizabeth. And so I even thought of trying to start one myself, but it's actually quite a difficult thing to start a support group. And then a lady actually sent an email to Al Gowar, wanting to get an interview on air because they were looking for volunteers. And then it was Reach for Recovery. Reach for Recovery is an NPO made up of primarily breast cancer survivors. We go into hospitals. We get names from doctors or the staff at the hospital. We go into the hospital before surgery and after surgery, and we visit women who we've been given their names because they need a little bit of support. We go and we just show them that there is life after cancer, that we're healthy, that here we are, we're thriving after our journey. And then we gift them with a little bag, which is what they can put their drains in. Because post-surgery, you'll have a drain that you need to carry around for a while. And then we give them a little cushion that they put under their arm just as some support after they've had their surgery. They get a journal where they can write their thoughts and that sort of thing down. And it's also got helpful telephone numbers that they can phone and that kind of thing. And we just give them support. If they're in a state hospital and they don't have medical aid, 6 to 8 weeks after their surgery, they actually can give us a call and come and fit for a prosthesis.
Oh, that's wonderful.
Which they can give a donation, but if they can't give a donation, that's fine. In October, we also have the mushrooms, the punnets, which are pink, and clover have the pink milk cartons. That money goes towards funding the prosthesis for Reach for Recovery.
Wonderful. That's wonderful.
Yeah. So that's where I found my niche. I've now found the support that I needed post my treatment with Reach for Recovery.
Because let's face it, as much as I can sympathize, I don't know. And even, my mom, my dad can't, you don't know what the journey is like unless you've been through it. So I would imagine that a support group as well of women who've been on the same journey, it must give you great strength and empower you.
Yes. No, it's amazing. We actually had training in March, and there were 20 of us, and to be in the same room with 20 other women or 19 other women that had been on the same journey.
Yeah.
It was the most amazing thing because we all had the same stories or similar stories that we could relate to each other. Reach for Recovery actually has 3 or 4 men in the organization as well that actually go and speak to men, because men also get breast cancer. Yeah. So a lot of the men probably feel more comfortable speaking to men. So there are some men at Reach for Recovery as well.
Ronel, from what you have to deal with on a daily basis, do you go for any kind of therapy? Because I would imagine what you are carrying the emotional load of so many patients.
Yeah, I personally see a therapist on a regular basis. I need to talk about the experiences.
Yeah.
I don't know, maybe people will judge, some of my more sort of hardened colleagues will judge me, but I feel sad when I have to tell somebody they've got cancer. 2 years ago, when I did the Algoa walk with Gill, I think the first 2 kilometers, I just cried.
I cry every year.
Because and every step I took, I was just thinking of patients and people I've known, either personally or professionally.
Yeah.
And it's hard. It's hard to watch somebody
Must be.
suffer.
Yeah.
So yeah, of course. I'm quite vocal about, doctors and well, anyone in the medical fraternity really, to be open about mental health issues.
Yeah.
But it's wonderful.
So, and it's difficult, and you need to manage it.
To take that on and then to go home, to switch off after what you've...
No, absolutely. Because when you go home, you don't want your family members to suffer your trauma.
Yeah.
So, it can possibly get a bit easy to just shut it off and then not think about it, and then
it's probably not
watch
healthy.
a movie and suddenly it all comes back to you. And
Yeah, it's
That is
wonderful.
hard.
It's
It
good
is
to hear. We
I think-
need more specialists like you.
I think people are more open to mental health now.
Oh, absolutely. I mean, if you, I've got a closed Facebook profile, but if you looked at my cover photo, it's me wearing 2 crazy socks, because once a year there's a Crazy Socks for Docs Day.
Yeah.
And I try and outdo myself from the one year to the next. Like, how crazy can my socks get for that particular day? And it's a countrywide movement to promote mental health awareness amongst healthcare professionals.
That's wonderful.
Yeah.
I didn't know that.
Yeah.
That's awesome. Okay, Jill, I want to ask you about dietitian Mary and Victor and how that has impacted your life in such a positive way. And also to tie in with the fact that one of my episodes was the importance of lifestyle habits in terms of the disease, going into it, your recovery, and
Yeah. So one of the side effects of, one of the things that letrozole does is it slows down your metabolism, which also means that you pick up weight. So Jordan and I both decided we were going to take matters into our own hands, and we were going to eat healthier, to be healthier. So I Googled for a dietitian, and I found Mary and Victor, who you had as a guest last week. And Mary Ann, one of her specialities is helping people that have been through chemo, if you look at her website, and people that have been through cancer. So we went to go and see her, and she actually designs an eating plan for you according to your lifestyle and, taking into account your health and your age and that kind of thing. And she designs an eating plan for you. So we are now, it's almost a year later, and we've lost weight, both of us.
It's great, yeah.
But it's not easy. It's hard. It's hard. It's not easy.
And she encouraged you to exercise, didn't she?
Yes. So I've always done aerobics or kinetics or that sort of thing. But obviously during chemo, they say you can exercise if you feel well enough, but who feels like exercising when you feel so sick? You know, just to get out of bed is an accomplishment. So, but then when the weight started picking up, I started exercising again, and I actually do online exercising. So I exercise every morning, and then combined with the eating plan, I'm probably the healthiest I've been since.
Wonderful.
Definitely before chemo.
That is great. And then tell me, I remember you telling me about some bone density test you went for, and because of the exercise, it had an impact upon your.
Yes. So chemo also affected my bone density. So that's one of the tests that I have done once a year. And it showed that my bone density had been affected, and I was at risk of actually having, it's osteoporosis.
Yeah.
And so I actually got quite a big fright, because you actually don't realize the side effects that long-term that chemo has on your body. And so I go and have these injections with Dr. Walton every 6 months. I have an injection, which actually it coats your bones and strengthens them, so to prevent it getting any worse.
Okay.
But I also started taking magnesium, and with the exercise, I do exercise specific to strengthening bones.
Yes.
And so this year, when I actually went and had the bone density test, I'd actually reversed it. So my bone density is back to what it was
great.
before chemo. Yeah.
Isn't that wonderful?
Yeah, you don't realize what happens to your body, because your body's fighting this battle for you. And I always chose to look at chemo as being, if I was sick, if I wasn't feeling well, it was a good thing, because it meant the chemo was working.
Yeah.
I chose to look at it that way, because if you're going to look at it negatively and tell yourself you feel so sick, you're never going to feel better, then it's a losing battle. So you've got to look for the positive in everything. But chemo does have long-term side effects. And one of the other things that I had was I developed cataracts.
That's
right. I had to have cataracts removed last year. But the awesome thing is now I don't have to wear contact lenses.
Wonderful.
So there's always the positive to everything.
Okay, so girls, takeaways. What would you say are key takeaways for the audience? Jill, from your side?
Early detection definitely saves lives.
Okay,
I know it's probably sounds like a cliche, because everybody
but it's not.
says that.
That's what we have to.
You have to be
get into people's heads. Be vigilant, and if you notice anything unusual about your body, go and have it checked out.
Yeah, definitely can't stick your head in the sand and say, if I ignore it, it's going to go away.
Yeah.
You can't do that.
Yeah.
But whatever happens, it's like Ronel always says, if it's come your way, it's come your way.
Yeah. Got it.
So you choose how you are going to tackle this.
And I think as well, it's very clear from the chats that we've had in the past that you often would speak about your medical team. And I think it's really important to have on your medical team somebody like a Dr. Ronel Gowar or Dr. Kathy Walton, right?
Definitely. And you know what? I often listen to podcasts, and particularly overseas, I've had ladies say that they're not happy with their doctors. Their doctors don't give them feedback. They, like quite cold and that kind of thing. And you have the choice to change. If you're with somebody that you're not happy with, you have the choice to find somebody that makes you feel comfortable, because you're fighting for your life. You need somebody that's all in with you. You can't have somebody that you have to fight with to get information, because you're all on the same team.
Yeah, it's so important. Just officially from a medical perspective, breast cancer treatment has to be done in terms of a multidisciplinary approach.
Yeah.
A surgeon cannot make all the decisions. An oncologist cannot make all the decisions. None of us can tell the patient what to do. It's got to be individualized, and every person needs to bring their expertise. And it's important, the more we know in medicine, I think the more specialized various people become. And I mean, I'm a plastic surgeon, and I wouldn't dare operate on a child with a cleft lip, for instance, because I haven't done it in many years. I'm not, it's not something I see all the time.
Yeah.
And I think when it comes to a cancer journey as well, that's important. It matters how experienced is your team, how invested is in your team, because treating cancer is difficult. And if that's not something that you are very passionate about, it's hard to communicate. It's hard to be good at it. So I think that's, find a doctor and a team that looks after you because they love it.
Yeah.
Yeah.
Resources, Ronel, that you would advise?
Well,
we know everyone does Dr. Google, but
look, there's a couple of websites that give a lot of good information, and I think breastsurgery.org it's an American website, and it covers everything you need to know related to breast cancer and the surgery, the chemo. It covers different types of genetic mutations that you can get. That goes through the various types of cancers. I mean, it's great information, and it's reliable. Yeah.
Ronel, I know your life is probably really, really busy, but in terms of the future, where cures and AI is involved, do you have anything you can tell us that you've read up about, or?
Well, nothing specific. I think the development of targeted therapies for various cancers it's a really exciting prospect and an exciting field, and there's a lot of drugs currently being tested and will ultimately be available to sort of a bigger scope. Right now there are drugs that are available in South Africa, but usually are on a trial basis, and at some point these will become available more sort of generally. It's interesting if you go back in terms of the history of breast cancer treatment, and you go back to the original breast surgeon William Halsted in the 1800s. I mean, the Halsted mastectomy actually comprised removing the breast, the pec muscles, the pectoral muscles, the lymph nodes, the skin. I mean, women were really mutilated.
Yeah.
And if you compare that to what the current sort of surgical thinking is, where almost less is more, we operate on the axilla considerably less than we did 5 years ago, 10 years ago. Breast conservation treatment is really, a good alternative. In fact, in some cases, even a better alternative to mastectomy.
Yeah.
So we're going to be doing a lot less surgery for breast cancer because our drugs are getting better. Our detections are getting better. So it's a positive field.
It's exciting.
Yeah.
There is hope. That's wonderful.
So,
Jill, any last words in closing?
No.
Advice? I think we've pretty much covered everything.
Yeah.
Ronel, anything from your side?
I wanted to just share a little takeaway note. Just be a rascal. So you can choose whether you want to be mischievous or you want to be a little sweet. But a rascal, RASCAL, reach out, be aware, screen, calm down, act, and then live. And that's the way to approach breast cancer. So as we're doing now, talk about it, reach out to ourselves, and know yourself, know your body. We encourage people to examine themselves. And yes, there are a lot of papers that tell you yes or no, whatever. Know what's there and what isn't there, so that when something changes, you're not in the dark.
Yeah.
Go for screening. There's a reason there are screening programs. And once something is found, just calm down. Calm down, because for the most part, we can manage it. We've got a plan. Don't, when you find something, just hope it's going to go away.
Yeah.
That lump doesn't go away. So act.
Yeah.
And then just remember that life will carry on when it's all said and done.
Yeah.
So just be a rascal.
And once you have a plan, you're empowered.
That's it. That's
Yeah.
it.
Thank
That's
you.
what you said.
Ronel, thank you so much. So
Absolute
appreciate your taking
It's a
time out to be with
Privileged
us.
to be here with you and to chat to you about this.
Honestly, thank you. And in closing, so last month we had our Algo FM Big Walk for Cancer launch at our premises, and Jill was one of the speakers. Her speech is deserving of a far wider audience, so I have asked her to please share it with us.
Cancer doesn't just take away your health, it takes away your sense of security. The world you once knew is turned upside down, and every day is a battle for survival. But I learned something through my journey. Survival isn't just about getting through the hardest moments. It's about finding a purpose beyond yourself and using your experience to help others on the same path. I know that I've been spared for a higher purpose, to give back and help other women navigate their cancer journey, find their light, and reclaim their lives. I'm here today wearing 3 hats. Firstly, I'm proud to be part of Algo FM, where I work as the executive PA to Alfie J. Secondly, I'm a volunteer with Reach for Recovery, one of this year's beneficiaries. And thirdly, and perhaps most personally, I'm a breast cancer survivor. My journey began in 2018 when I was first diagnosed with breast cancer. Surgery and 15 rounds of radiation followed. In 2022, I had a recurrence. This time it was more aggressive. I went through 6 grueling months of chemotherapy, followed by multiple surgeries and complications. It was the toughest year of my life, physically, emotionally, and mentally. But I was never alone. I had an incredible support system, my family and friends, my Algo FM family, and an amazing medical team. They carried me through the darkest days. When I had completed active treatment and was declared no evidence of disease, I knew in my heart that I'd been spared for a reason. Not everyone has that kind of support. So many women walk this road feeling isolated, terrified, and overwhelmed. That's why I became a volunteer at Reach for Recovery, because no woman should have to face this alone. Reach for Recovery is more than a support organization. It's a sisterhood. We bring a message of hope. We sit beside women in their fear and remind them that they are not alone. We are a living testimony that they too can survive and thrive. There is life after cancer. Cancer is often referred to as the Big C, but at Reach for Recovery, we've redefined what the Big C means to us. To us, the Big C stands for courage, connection, compassion, and care. I'd like to leave you with the following words from Nelson Mandela. There can be no greater gift than that of giving one's time and energy to help others without expecting anything in return. Thank you.
And the Big C podcast series is proudly brought to you by Algo FM. In the next episode, we'll be looking at NPOs that support the public healthcare system. These are Siyavuka for Kids, Flamingo Project, and Reach for Recovery. These NPOs are also our beneficiaries for this year's Algo FM Big Walk for Cancer. Till next time, take care.